Velis Medical was built on 3 foundational pillars: technology, customer service, and education. As part of our ongoing efforts to provide on-demand education, we offer this step-by-step video guide to a SkinPen treatment, following the FDA-cleared instructions for use. The SkinPen Precision System is a microneedling device and accessories intended to be used as a treatment to improve the appearance of facial acne scars in adults aged 22 years or older. This video does not cover all content included in the SkinPen instructions for use, which should be reviewed prior to any SkinPen treatment. Should you have any questions regarding the content of this video or the use of your SkinPen, please contact your Velis representative or our customer service department at 888-372-3982. To be best prepared for a SkinPen treatment, have your tray prepared prior to your patient coming in or while they are numbing. All needed items should be laid out, including the single-use, non-latex gloves, the SkinPen device, SkinFuse Purify Cleanser or another gentle cleanser of choice, cleansing cloth or sponges, alcohol and swabs, and the content of the SkinPen Treatment Kit Plus, which includes the BioSheath, the Advanced Cartridge Unit, SkinFuse Lift Hydrogel and Rescue Calming Complex tubes, and single-use packets of benzocaine, lidocaine, and tetracaine. It is also a best practice to apply the BioSheath while the patient is numbing or before a patient enters the room for a SkinPen treatment. With gloved hands, hold a clean SkinPen in one hand and a new BioSheath in the other. Lift the white tab and slide the device between the plastic and paper backing until snug. Peel off the cover by pulling the blue tab upward and the paper backing off. Then, remove the white tab to seal the device. Installing the cartridge. The SkinPen cartridge is unique amongst its competitors as the reciprocating mechanism is housed within the cartridge, not the device. This allows for a precisely calibrated cartridge with each application. Because of this, and the fact that each advanced cartridge unit has a lockout feature for safety, special attention is needed to install each new cartridge. Start by removing the paper backing on a new cartridge. Then, identify both the center seam on the device and the depth arrow pointing to 0 on the cartridge. The cartridge will only fit on the device when the arrow is at a 1/4 counterclockwise turn off the center seam on the device, which makes the center seam appear to be more in line with the 2.5 mm depth setting. The reason being, once in place, the device will be turned clockwise to lock into place, and the center seam will align with the arrow that points to 0. Now, there is a male and female half-moon shape within each device that must be aligned for application. Holding the base of the cartridge, identify those shapes and match them up. You may have to turn the metal half-moon in the device to gain alignment. Once aligned, set the cartridge on the device, still holding the cartridge by the base, and slowly turn the cartridge counterclockwise until it clicks into place, indicating it's locked. You should now see the center seam aligned with the depth arrow at 0. Cleanse and prep skin. As with any medical procedure, a clean area is a must before you begin treatment. We suggest using a gentle cleanser, like SkinFuse Purify Cleansing Complex, to remove any numbing agent or debris. Purify is a gentle yet effective cleanser formulated for use pre- and post-microneedling procedure. It utilizes ethyl macadamia to emulsify makeup, sunscreen, and surface oils with 5 mild, plant-based surfactants to gently cleanse the skin. Omitting irritating ingredients, Purify thoroughly cleanses without drying or inflaming the skin, and also includes a proprietary peptide and a pH-balanced formulation. Once the face is thoroughly cleansed, apply a cloth or towel to protect the patient's clothing. Finish the skin preparation process by gently sweeping the area with an antiseptic solution-soaked swab, ensuring the entire intended treatment area is clean and swabbed. Once the face is completely free of debris, you may consider taking a before photo if you haven't done so already. Lift HG application. You are now ready to apply Lift, a hydrogel-based formulation developed specifically for use during and immediately after microneedling. Lift Hydrogel is FDA cleared as part of the SkinPen Precision System and comes with every treatment kit and Treatment Kit Plus. The purpose of hydrogel is to protect against abrasion and friction during the microneedling procedure. It may be applied additionally the day of the procedure to prevent the skin from drying out post-procedure. A thin layer of lift should be applied to the intended treatment area. Be careful not to apply too thick a layer, as this could clog the cartridge. If you are new to microneedling, consider applying lift to each section to be treated to accommodate a slower treatment time and to keep the product from drying out. Begin procedure. Ensure the depth is set to 0 and power on the device by pressing and holding the power button for 2 seconds. Adjust needle depth settings on the SkinPen cartridge by twisting the depth cup. New settings will be indicated by a click into place. Start at a depth setting of 0.25 mm and increase in increments of 0.25 mm or 0.5 mm until desired erythema is reached, with a maximum depth of 1.5 mm on the face. Stretch the skin taut and begin moving the device slowly in controlled horizontal and vertical motions, with the tip of the cartridge completely flush with the skin to ensure consistency in needle penetration. It is recommended to treat the face in a series of 4 quadrants, starting with the right cheek and moving to the chin, perioral area, and nose, then to the left cheek, then to the forehead. For treatment of acne tissue, a depth of 1.5 mm may be used on the face. Right cheek continued. Continue to treat the right cheek, section by section, holding the skin taut and moving in a horizontal path, then overlapping in a vertical path, then making tiny, slow, circular motions. The SkinPen Precision device allows for incremental increase in settings to allow for the variability in thickness of healthy skin and acne scar tissue. It is essential that the thickness of the patient's skin in each anatomical area to be treated is assessed by a quality clinician to address any potential risk of injuring delicate structures beneath the skin. Such structures include, but are not limited to, the supraorbital nerve, the terminal branch of the frontal nerve that provides the sensory innervations for the skin of the forehead, mucosa of frontal sinus, and the skin of the upper eyelid, and the temporal, buccal, and marginal mandibular branches of the facial nerve, motor nerve that controls facial muscle movement. No adverse events were observed relating to such structures during the SkinPen clinical study while treating at a needle depth of up to 1.5 mm. Please refer to the Bellis Training module on superficial nerve and vessel facial anatomy found on bellistraining.com for additional information. It may be necessary to go over certain areas of the skin, like areas with an abundance of acne scar tissue with multiple passes. The chin and perioral area. Once the right cheek is complete, move to the chin area. If you have not already done so, add lift hydrogel to this area prior to treating. In this patient's case, the depth setting of 0.75, which was used on the cheek, was sufficient to achieve the desired result, and there was no need to increase or decrease the depth for this area of the face. Complete the right side of the chin using vertical and horizontal passes, then small circular motions, as seen here, being careful to avoid moving inside the border of the lip. If you choose to use numbing cream to improve patient comfort prior to a treatment, make sure you or the patient apply the numbing cream in all areas to be treated, right up to the edge of the treatment area. This can be an especially important detail when applying cream around the lip area, as patients often leave this highly sensitive area untouched, which may be felt later during the procedure. The upper lip. As you move to each new section of the face, get comfortable. It may be necessary to move the position of your body and hands in order to improve visibility, increase your comfort or grip, and keep the tip of the cartridge flush with the skin, especially when going over curvy, bony structures like the chin or nose. You always want to be in a position where you can comfortably hold the patient's skin taut and visibly see the amount of redness after each pass. As you move to the upper lip, consider smaller, shorter, one-directional strokes. You may ask the patient to press their lips together to stretch and firm up the treatment area under the nose, above the lip. This is especially helpful for patients with a strong, protruding Cupid's bow, as that area would be too bumpy to treat if the lips were not pressed. The nose. When treating the nose area, you want to dial down the depth. In the case of this patient, we moved the depth dial from 0.75 millimeters to 0.5 millimeters. Gently hold the nose stationary on one side as you begin to treat the other side. Holding the nose with light pressure, like this, will help quell the vibrations, which can tickle a little, so be sure to let the patient know to expect a tickle sensation when you begin treating the nose. You may also ask them to breathe through their mouth and raise a hand in the instance they feel the need to sneeze. It is a little harder to complete full vertical, horizontal, and/or circular strokes depending on the area of the nose you are treating. You may need to gently bend the nose to gain access to the creased areas. Be mindful of the number of passes you make and the skin's response, overlapping as necessary. The depth range suggested for the nose is 0.25 millimeters to 0.75 millimeters. The left cheek. Once the center of the face is complete, you will move to the left side of the face and subdivide the cheek. Prior to starting treatment on the left cheek, make sure to dial the cartridge to the same depth that was used on the right cheek. Notice, each line and corresponding click on the depth cup as you turn it equates to 0.25 millimeters. So, moving from 0.5 millimeters up one click takes you to 0.75 millimeters. Besides clicking into place, the depth dial is also placed low on the cartridge to help practitioners avoid accidentally dialing the depth up or down during treatment. And the ergonomic design of the device allows for a comfortable grip throughout the treatment. Difficult to treat acne scars. Again, you will move from section to section on the left cheek using your horizontal, then vertical, then circular passes with more focus on the areas with deeper acne scars. Should you need to dial up to higher depths, it is important to recall that the motor in the SkinPen revs consistently at 7,000 RPMs at all depths, regardless of skin density, and the needles are calibrated to penetrate to precisely the depth dialed on each rotation. That means that you may need to slow down your motion to a slow glide or even a stamping motion to ensure the depth penetration is met in your target area and there is no skipping that occurs. However, it is not necessary to add any additional pressure, regardless of tissue density, as the SkinPen has been validated to penetrate to the set depth, unlike other devices which can vary in penetration, especially when set at 1.5 millimeters or greater. Orbital rim considerations. As you move up the cheek or near the orbital rim, to avoid treating too closely to the eye area, you can place your thumb on the top of the cheekbone or the orbital rim as a guide and to help hold the skin taut. Once you are ready to treat the orbital rim area, it's time to dial the depth down. It's suggested to begin at a depth of 0.25 millimeters, staying in the range of 0.25 millimeters to 0.5 millimeters. So, starting at a depth of 0.25 millimeters, begin with slow passes on or outside of the orbital rim. Careful not to go inside the rim to the upper or lower eyelids. Check in with the patient for comfort during this part of the treatment. The forehead. Recommended depth range for the forehead ranges from 0.25 millimeters to 1 millimeter. In the case of this patient, we are dialing up the depth from 0.25 millimeters to 0.5 millimeters and beginning with our vertical and horizontal passes before moving to small circular motions. According to a 2015 article published in the Aesthetic Surgery Journal, the thickness of the skin on the face can range from 0.8 millimeters up to 2 millimeters, depending on location, with the thinnest skin on the eyelids and the medial canthus, or inner corner of the eye, and the thickest skin around the nostril. For that reason, make sure to use the eyebrow as a natural border when treating the forehead and not to go beneath the brow to the delicate lid. Now, the forehead area, based on this study, has an average thickness of around 1.2 millimeters, with the glabella area coming in a little higher at 1.4 millimeters. When treating the glabella, make a V shape with your free hand by placing a finger above each brow. This will allow you to lift and access the natural furrow of the glabella area during treatment without applying additional pressure to the device. Finish off each section of the forehead, achieving a similar erythema endpoint as the rest of the face and overlapping areas with deeper acne scars as needed. Immediate post-care. Once you have completed your treatment, gently use sterile gauze to pat down the affected area before applying a generous layer of Lift HG. Because transepidermal water loss is at its highest immediately following a procedure, Lift HG comes in a 1-ounce tube, and the remainder of the tube should be given to the patient and may be applied for the next 24 hours to prevent the skin from drying out. Also, provide the patient with the 1-ounce tube of Rescue Calming Complex, which can be used beyond 24 hours post-procedure. Advise patient to avoid sweaty exercise and sun exposure for 72 hours post-procedure. It is recommended to avoid other facial aesthetic treatments the month following the SkinPen Precision treatment. Before the patient departs, make sure to schedule their next appointment in 4 weeks. Cleanup. To remove the cartridge, hold the SkinPen Precision perpendicular to the floor or with the cartridge attachment tip pointing downwards. Use one hand to remove the cartridge and the other to hold the device. Dispose of the cartridge in a sharps container. Continue to hold the SkinPen Precision device perpendicular to the floor with the cartridge tip pointed downwards, and pull apart the adhesive strip of the biosheath, careful not to touch the device with your gloved hands. Remove the biosheath by carefully rolling it down the SkinPen to prevent soiling the handpiece, and dispose of the single-use sheath in a biohazard container. Disinfection of the SkinPen Precision should be completed with the use of SaniCloth HB wipes. For additional details on how to clean your SkinPen, see Section 9 of the IFU Cleaning of SkinPen Precision and Charger Base, or review the SkinPen User Manual. This concludes our training on the SkinPen procedure. Should you have any questions, please feel free to contact your Bellis representative or call our customer service team at 888-372-3982.